Hello, my name is Pete Hopgood. I'm the Director of Finance and IT Services at Powys Teaching Health Board. I'm going to talk you through the Health Board's financial performance for the year 2019 and 2020. First of all, I would like to congratulate everyone in the Health Board for their contribution in helping the Health Board meet its key financial and statutory targets. Well done to all of our budget holders for delivering against the challenge of providing high quality patient care for our population and balancing the books. As you can see by the slide, that we've met our revenue statutory duty to deliver a break-even position, to meet our statutory capital position to deliver a balanced capital position against the funding allocated, and to meet the administrative target of paying all non-NHS invoices within 30 days. This slide details our revenue financial performance over the last 3 years. As you can see, we've delivered a surplus of 216,000 over a 3-year period and met the 3-year duty to not exceed. This is a significant achievement against the 920 million expenditure profile for the 3 years as referenced. This slide details our capital financial performance over the last 3 years. You can see we've delivered a £20,000 surplus for the 3-year period and met the 3-year duty not to exceed the funding as allocated. Again, this is a significant achievement against the 13 million expenditure profile. This slide details our public sector payment policy performance, and as you can see, we've hit a target of 96% of all non-NHS invoices being paid within 30 days. So where do we spend our money? This is looking at the revenue position. Our total annual expenditure is 339 million. It's spent in 3 main areas: primary health services, healthcare from other providers, and hospital and community services. Our total expenditure increased from the previous year from 313 million to 339 million. So for primary health services, how do we spend our money in this area? Well, the following pie charts identify the different breakdown of spend and compare year on year for 18-19 and 19-20. As you can see by the blue segment, general medical services, GMS, or GP services, if you want the area of our main expenditure. You can see there has been minimal increases on most lines comparing year on year. Next, we have healthcare from other providers. Again, the same pie chart diagrams to help identify our different spend in this area. As you will see from the orange segment, this is our payment for services provided by other organisations outside of NHS Wales, and the blue segment is for services provided by NHS Wales providers. You can see it there on the slide, there's a little explanation for the increases, but the broad percentages are roughly the same as in previous years. Final breakdown of spend. This picks up on hospital and our community spend. This is our provider element of our services. As you can see, the majority of the spend is in relation to pay for our staff and all those who work to provide the services that we provide as Powys Teaching Health Board. Next area to highlight, this gives you our top 5 capital programme expenditure. As you remember, I said that we've remained within our capital resource limit, but just identifying there, our main areas of spend have been the Llandrindod reconfiguration, the purchase of medical equipment devices, the Llandrindod Wales renal expansion, various expenditure in relation to IT, and also medical gases upgrade. And that accounts for 2.4 million of our total 3.2 million spend in 1920. So in summary, the Health Board has delivered against its financial targets. Congratulations and well done to everyone. This is a fantastic achievement. As a reminder, we've remained within our revenue resource limit. We've remained within our capital resource limit. And we secured Welsh Government approval for a 3-year IMTP, Integrated Medium Term Plan. We also received an unqualified audit report from the Auditor General on the true and fair view of our accounts. So to sum up, thank you and well done to everyone.